So when you look at ice does help with pain management. The first thing we want to do when we're hurt is not move. You have to move. Even if you can't move that body part, move the rest of your body. Choline deficiency during the early infant years is one of the precursors to ADD, ADHD behaviors. Grains spike your blood sugar fast. They trigger insulin, which is your body's fat storage hormone, right?
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
So when you look at ice does help with pain management. But our bodies really actually need the inflammatory response in an acute injury. That's what actually encourages the healing. And this use of NSAIDs and ice right away to blunt that response, which is the body's normal response to try and get all the proteins in there to start healing the injury, is gone, right? So we're no longer getting any of those benefits. It causes vasoconstriction, which blocks the transport of all the healing agents to the injured areas. And studies keep, the study by Takagi said that ice in the acute stage not only induced a delay in late stages of muscle regeneration, but complete impairment of muscle regeneration. So I agree. It's the first thing you want to do when something hurts. Throw some ice on it. Try actually to use a little heat instead. Try and stay away from the heat. So what is I do want to kind of comment back up on the research that distinguishes inflammation from swelling, right? Inflammation is the first phase of tissue process healing. It's a defense mechanism, okay? And inflammation, even though painful, is helpful. We want inflammation there. We want that redness. We want that. If you blunt it with NSAIDs, great study that came out just post-surgery using NSAIDs. People had significantly delayed recovery just using NSAIDs post-surgery. So I'm more a fan of controlling pain with just a little pain meds and staying people off of NSAIDs for the first 3 days. The first thing we want to do when we're hurt is not move. You have to move. Even if you can't move that body part, move the rest of your body. Because movement is what gets all this blood flow. It's what brings all these chemokines and cytokines that are starting the healing response. So you have to move. Even if you don't feel like it, you have to move. Exercise. Once you can, start doing gentle motion with the joint, okay? So once it's possible to start moving it, start moving it. Even if you have to passively move it. One of the things Zach, our PA, always tells people after do shoulder injections is just, wall walks, Codmans, roll it around. You want motion. And then, in terms of analgesia, you want to pull that in, again, that day 3. And then using treatments, meat treatment. What else can we do? TENS. We can use class 4 lasers. We can use TENS units. We can, do other things. We can do infrared. We can do PEMF. Those are all things that are going to encourage healing. So use those for your pain control. Use treatment modalities instead. What supplements or peptides for a breastfeeding mom? I assume prenatals and DHA or high-quality fish oil are basics, but what else might be recommended? First of all, yep, you're right on. You need just a good high-quality prenatal with good methylfolate, methyl B12 in it. You need a really lot of DHA, omega-3 fatty acids. So you can eat that fish roe. But DHA fatty acids, one of the most important nutrients for babies' neural development is DHA fatty acids. D3, please don't forget your D3 because I've seen a lot of women develop horrible osteoporosis during the nursing period because they weren't getting adequate D3. Choline is the most forgotten. Breastfeeding women need almost twice as much as the rest of us, even more than during pregnancy. And most women aren't eating enough choline. We absolutely know that choline deficiency during the early infant years is one of the precursors to ADD, ADHD behaviors. And it's probably why we see so much of that is because nobody gets enough choline. Magnesium, also functional, getting good 500 milligrams of magnesium. I'll also tell you that we know that more collagen, bone broth, organ meat, protein, those are all really critical too because we just need more protein sources too as well. And then I think one of the forgotten things is iodine. So iodine requirements double during breastfeeding, okay, compared to regular adulthood. So that's really important for not only your own health, your thyroid health, your brain health, but the baby as well. Then I'm going to throw in plasmalogens. Breast milk's full of plasmalogens. It's the most rich source of plasmalogens. Throw in a little more. You want a really smart kid? Plasmalogens are so critical for the neural development of the baby. That's why the breast milk is so rich in them. So add a few extra in. No harm in that, right? Okay. Tony asks, our government advises us to eat lots and lots of breads and cereals and grains as the base of the food pyramid, better for us than fruits and vegetables. Yet all farmers know grains make cattle gain weight surprisingly fast. Your view? Yeah, here's the science. We know that grains spike your blood sugar fast. They trigger insulin, which is your body's fat storage hormone, right? That's how you fatten livestock. You get a high level of insulin, so they put on a lot of fat. And then when that insulin floods your system, you stop all the fat burning, you promote fat storage, so all the fat goes into your belly and the legs and everything like that. And then over time, you lead to insulin resistance. So, in general, you're right. Grains are bad. Okay. But I'm a fan of keeping metabolic flexibility. I'm not a fan of taking all the grains out of the diet. What I prefer is to choose the right grains. So you can do things like use quinoa. Quinoa is a complete protein that doesn't spike your blood sugar like refined grains do. Or buckwheat. So buckwheat is gluten-free. It's packed with compounds that really support heart health. So buckwheat is actually a really nice option. Amaranth. Amaranth contains tons of lysine, which is great for muscle repair. Most grains don't have lysine. Lysine is not that easy to get. So basically using amaranth and millet's alkaline forming. So unlike most grains, alkaline. And so we actually get this easier digestion. We alkalinize our body, which is better for our immune system. So I think it's not just, grains themselves. Let's look at healthy grains. Let's try and keep metabolic flexibility. And then always when you're eating grains, if you're going to eat grains, then you can modify the insulin spike by always pairing it with a protein and fat, right? So always eat your protein and fat first. And that's going to slow down the digestion and that insulin response. So that's a trick you can always do. Always eat the protein first and then the carbohydrate, and then you're going to slow down that insulin response. Also, soaking grains or sprouting them will help. And then keeping it small, a fistful, right? Keeping the grain portion small. Again, I am a believer in we have to live, we have to do things. So use tricks, use things, use other grains. But also if you're going to eat something bad, now and then, just do it appropriately. If I look at things like glaucoma or other eye pathology, one of the peptides that's really starting to be researched for eyes is humanin. So humanin we have researched a lot for neuropathology like Alzheimer's, but it's a mitochondrial-derived peptide, and it's particularly relevant to glaucoma because we really think now that mitochondrial dysfunction is the main reason, the key factor in glaucoma. So, it's also a key factor in the retinal ganglion cell degeneration that glaucoma can cause. So that's the reason we are so aggressive at treating glaucoma, is because that high pressure creates retinal cell degradation, and humanin seems to protect significantly against that. Super cytoprotective. We've been using it even in our patients with macular degeneration. There's some nice data on macular degeneration with humanin. So I think this is a peptide we should keep an eye on, and we're using it and seeing some really actually super nice results in some of these disorders. It really protects cells from stressors, and that's what's happening in our eye health and why we're losing vision and things like that. So that neuroprotection from humanin. If you're looking at other things that kind of might have a similar effect but are easier, visomycin is another. It's a Russian peptide. Or Russian eye medicine. It's a peptide called SKQ1, and it's a mitochondrial targeted antioxidant. So it was developed to combat stress in the ocular tissue. It's been shown to also be potentially helpful, particularly with dry eyes, but also with some of the glaucoma and other issues. I think that the thymosin beta-4 eye drops, not a lot of documentation of that in glaucoma, but definitely for dry eyes and some of the other pathologies, both BPC and thymosin beta-4. BPC eye drops, I'm not so certain they do much, but thymosin beta-4 eye drops, I think, do help a lot. And then using platelet-rich plasma eye injections too, or or eye drops. You have your doctor just make you some platelet-rich plasma eye drops because that's containing all the growth factors to help heal things as well. But keep in mind huminin, keep an eye on huminin. That's been our go-to now for eye pathology. So Epitalon is really a synthetic, what we call tetrapeptide. It's 4 amino acids. It was developed based on epithalamin, which is a pineal gland extract. So the pineal gland is what's regulating our circadian rhythm, and this is an extract from the pineal gland. So they took that and they made a synthetic peptide out of it. And its primary mechanism, so both epithalamin and Epitalon, the primary mechanism is to stimulate the pineal gland to more normalize melatonin production and release. So what does that do for sleep? Well, it's going to help restore the normal circadian rhythm. It's going to encourage my pineal gland to produce proper amounts of melatonin at the right time. Now, yes, you can just take melatonin, but that's not correcting your own pineal gland problem, right? So we know that increases deep sleep phases. We know that it helps sleep maintenance, so it helps you stay asleep longer. Enhances sleep quality. Pinealon, on the other hand, is also a synthetic peptide, meaning it's not made endogenously in us. It's a tripeptide. And pinealon actually does cross the blood-brain barrier more readily than Epitalon. So it does get to your brain a little faster. They both will, but a little faster than Epitalon will. But it's not really working on melatonin. Its primary effects and how it would help sleep have to do more with neurologic function. So it probably helps sleep primarily through its neuroprotective effects, not its circadian rhythm balancing effects. So pinealon acts as a neuroprotective agent to settle down the neuroinflammation. And so that probably helps the sleep disturbance in these people who have a lot of anxiety, right? Anxiety is a neuroinflammatory condition. So if you're not sleeping because you have this high anxiety state, pinealon is going to be a better choice. So for me, and I think for a lot of the data that's out there, probably Epitalon is the preferred choice for just kind of trying to restore our normal balance. Like, you don't have a lot of neuroinflammation, things like that, but you just are out of circadian rhythm. The older shingles vax, which was called Zostavax, was a live attenuated virus. It had a lot of problems, had some pretty serious complications. I was not a fan, and I would never have recommended that vaccine. But the newer vaccine they're using, which is called Shingrix, is actually, it's a non-live subunit vaccine. Okay, so it's a much more normal type vaccine where we're using a non-live subunit. And so it's a much safer vaccine. It does seem to have a pretty immune-provoking response in a lot of people. So a lot of people get a lot of local reactions. They don't feel well, things like that. So there is definitely some local issues with it, but they tend to be not systemic. So then we go to, well, is it effective? It appears that in the older age group, like over 70, this does appear to have a pretty effective effect against shingles. It appears in the younger people, the 50s, maybe not so much. Doesn't appear to have, and that's an interesting response because usually our immune systems get worse, but that's what the data supports. And I always hear this from my patients, I had shingles, I should get the shingles vaccine. Actually, if you had shingles, you actually probably have a lot more protection than getting the vaccine. There's really not a reason then.